ನನ್ನ ಹೆಸರು ವಿನೂತ. ನಾವು ತುರುವೇಕೆರೆ ತಾಲೂಕಿನಿಂದ ಬರ್ತಾ ಇದ್ದೀವಿ.
ಅವನು ಸುಮಾರು 6 ತಿಂಗಳಿಂದ ನೀರು ಸಹ ಕುಡಿತಿರಲಿಲ್ಲ, ಊಟ ಅಂತೂ ಮಾಡ್ತಿರ್ಲಿಲ್ಲ. ಅನ್ನನಾಳ ಬ್ಲ್ಯಾಕ್ ಆಗಿತ್ತು ಅಂತ ಸುಮಾರು ತುಮಕೂರಿನಲ್ಲಿ, ತಿಪ್ಟೂರಿನಲ್ಲಿ ಎಲ್ಲ ಹೊರಗಡೆ ಎಲ್ಲ ತೋರಿಸಿದ್ವಿ. ಅವರು ಏನಾದ್ರು ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟರು, ಅದರಿಂದ ಸಕ್ಸಸ್ ಆಗಿರಲಿಲ್ಲ. ಈಗ ಯಾರು ಅಡ್ವೈಸ್ ತಗೊಂಡು ಬೆಂಗಳೂರು ಮಣಿಪಾಲ್ ಹಾಸ್ಪಿಟಲ್ ವೈಟ್ ಫೀಲ್ಡ್ ಬಂದ್ವಿ. ಅವ್ರ ಹತ್ರ ನಿಖಿಲ್ ಅಂತ ಡಾಕ್ಟ್ರು ಯಾರು ಅಡ್ವೈಸ್ ತಗೊಂಡು ಒಳ್ಳೆ ಡಾಕ್ಟ್ರ್ ಇದ್ದಾರೆ ಹೋಗಿ ಅಂತ ಅಲ್ಲಿ ಹೇಳಿದರು. ಅವ್ರಿಗೆ ನಮಗೆ ತುಂಬ ಹೆಲ್ಪ್ ಮಾಡಿದ್ದಾರೆ. ಅವರಿಗೆ ಅವನು ಸರ್ಜರಿ ಮಾಡಬೇಕು, ಎಕ್ಸ್ರೇ ಮಾಡಿರು, ಸ್ಕ್ಯಾನಿಂಗ್ ಮಾಡಿರು, ಎಲ್ಲ ಮಾಡಿದ್ವಿ. ಎಲ್ಲ ಥರದ್ದು ಟೆಸ್ಟ್ ಎಲ್ಲ ಮಾಡಿ ಬ್ಲಡ್ ಬೇರೆ ರಿಪೋರ್ಟ್ಸ್ ಎಲ್ಲ ನಾರ್ಮಲ್ ಇತ್ತು.
Hi everyone, I am Dr. Nikhil Shalagi, consultant surgical gastroenterology and laparoscopic surgeon at Manipal Hospital Whitefield. Here we have my patient Mr. Jayant, who is 30-year-old, who presented to us with history of difficulty in swallowing and vomiting for past 6 months. So he was seen at multiple hospitals outside and was treated, but eventually they came to us for the final solution. So we went through all his previous records and we found that he was diagnosed to have a condition called esophagectomy, where the lower end of the food pipe is narrowed and they'll have difficulty in swallowing. But since the only treatment for this is either endoscopic dilatation or surgical treatment, but in view of multiple other reasons, he was offered an option of stenting. So he underwent endoscopic stenting at another hospital. So post stenting, patient was doing fine. He was tolerating liquid food and to some extent soft diet. But again, gradually over a period of 1 month, he started having those similar symptoms which he had, like vomiting and difficulty in swallowing. So this is the time when the symptoms worsened, they presented to us. So we did a detailed evaluation and saw what exactly was done previously. When we did an endoscopy here, we saw that the whole of the food pipe where the stent was placed was completely narrowed. So we couldn't negotiate further and go into the stomach. This led for him to have continuous vomiting. So then we thought that the only solution is to excise this diseased portion of the food pipe and the stomach and then rejoin. But the issues were upfront surgery was not an option because his general condition was poor and he had lost a lot of weight and his protein levels in the blood were very low. So what we did was, initially we got an endoscopy done and a tube was placed through his nose and into the stomach to bypass that obstructed area. And then he was kept on tube feedings for 1.5 months. Luckily patient was compliant and he was tolerating tube feeds. And 6 weeks later, when we reassessed, his general condition was much better, his protein levels were better. Then we thought that we will go ahead with surgery.
ಅದು ತುಂಬ ಸಕ್ಸಸ್ ಆಗಿದೆ. ಈಗ ಊಟ ಎಲ್ಲ ಮಾಡ್ತಾನೆ, ನೀರು ಕುಡಿತಾನೆ, ಓಡಾಡ್ತಾನೆ, ಎಲ್ಲ ಮಾಡ್ತಾನೆ. ಮೊದಲು ಎಲ್ಲ ಫಿಸಿಕಲಿ ಫಿಟ್ ಆಗಿದ್ದ, ಬಟ್ ಈ ಊಟ ಇಲ್ಲದಲ್ಲೇ ಸ್ವಲ್ಪ ತುಂಬ ವೀಕ್ ಆಗಿದ್ದ. ಈಗ ಮಾಡಿಸಿದ ಮೇಲೆ 2-3 kg ಇಂಪ್ರೂವ್ ಆಗಿದ್ದಾನೆ. ಊಟ ಮಾಡ್ತಾ ಇದ್ದಾನೆ ಆಲ್ರೆಡಿ. ಎಕ್ಸ್ಟ್ರಾ ಕೇರ್ ತಗೊಂಡು ನಿಖಿಲ್ ಸರ್ ನನ್ನ ಹುಡುಗನಿಗೆ ತುಂಬ ಚೆನ್ನಾಗಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟಿದ್ದಾರೆ, ನೋಡ್ಕೊಂಡಿದ್ದಾರೆ ಅವರು.
So patient had very smooth recovery, uneventful recovery. Post-operative was well managed by the ICU team and the critical care team. And a good physiotherapy and other rehabilitation in the post-op helped us to get him out of this surgery. We are happy that patient has come back for follow-up after 2 months and he has gained weight and he is tolerating normal diet.
ಮಣಿಪಾಲ್ ಹಾಸ್ಪಿಟಲ್ ಅಂದರೆ ನಂಬರ್ 1 ಹಾಸ್ಪಿಟಲ್ ಬೆಂಗಳೂರಿನಲ್ಲಿ. ನಾವು ಎಷ್ಟೋ ಕಡೆ ಸುಮಾರು ಕಡೆ ನಾವು ಪೇಷಂಟ್ ಬೇರೆ ಕಡೆ ಎಲ್ಲ ಹೋಗಿದ್ವಿ. ಈ ಥರ ಸ್ಪೆಷಾಲಿಟಿ ಎಲ್ಲೂ ಇಲ್ಲ.
ಮಣಿಪಾಲ್ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಡಾಕ್ಟರ್ ನಿಖಿಲ್ ಸರ್ಗೆ ತುಂಬ ಧನ್ಯವಾದಗಳು.